Hi, welcome to tonight's webinar. I'm Jonas Chong, Parapsychology Department here at Sanaviv. I'm here with Dr. Fernando Mercado. Good evening. Dr. Mercado has been with Sanaviv for 9 years, and he's one of the doctors here at Sanaviv that combines this aspect of holistic health and healing because of many trainings he's done, actually being a yoga teacher and instructor, and also a medical doctor. So he's lived, all across the board of all of these different therapies and treatments. And today he's going to be talking about just a wonderful treatment called hyperthermia in cancer treatment. So we're very happy to just be sharing this topic with you. So I leave the word with Dr. Fernando, and off we go.
Thank you, Jonas. Good evening, everybody. Well, tonight we're going to talk about this treatment called hyperthermia. That perhaps the name might sound modern or new. However, the therapy is rather old. Actually, it's one of the using heat to treat cancer was one of the first therapies that medicine tried to use for this purpose. So to begin with, I would like to talk about the definition of this term to have everything clear and understand very well what we're talking about. The Greek Latin roots of this term, hyper, is the first one, which means over, above, or in excess. The second root, which is therm, means heat or temperature. So the medical definition of this word, hyperthermia, it's the therapy in which tumor temperature is raised to values between 41 and 45 Celsius. Fahrenheit would be 105 to 113 more or less by external means. There are basically two kinds of hyperthermia. One is active, which is the physiological fever that happens when we have an infection. However, in the late 1800s, a doctor called William Coley, he started treating patients by inoculating living bacteria, triggering a physiological fever. That wasn't further researched on its effects on the tumoral activity, but it certainly established and led to the development of immune therapy in cancer treatment. However, our topic is basically two modalities that we utilize at Sanoviv, since Dr. Wens focused his attention and wanted us to gather the best treatments available out there and try to integrate them with what we were previously doing here. So this is the passive hyperthermia. There are two kinds. One is the whole body hyperthermia, which is delivered by different means, different kind of energies, and there are many equipments out there that can do this. We work with a couple of German devices, one for the whole body and the other one for the local regional hyperthermia, which is basically hitting only one part of the body, or in this case, only where the tumor is located. This slide will be kind of the core of our talk. I don't want to go much into detail or get into complicated scientific terms, but basically these are the effects of the hyperthermia, either by whole body hyperthermia or the local regional hyperthermia on the tumoral tissue. So on the intracellular level, the applying heat to the tumor, it certainly activates certain repair mechanisms which will make the cancer cell stress more into its own already disturbed function. We have to understand that tumor cells or the tumor biology, it has a higher metabolism, which means that the disorganized replication of cancer cells require a lot of energy, a lot of glucose in this case, and they grow so rapidly that it's very erratic, and that's what certainly defines cancer. So the cancer cells are already in a very stressful environment, and in this case, noting that these heat shock proteins, or also known as stress proteins, are in the intracellular level and also on the cell membrane. These heat shock proteins play a very important role in the effects of the applying heat to a tumor in the hyperthermia, because the intention of the heat shock protein is to provide more stability to the cancer cell. But on the other side, this heat shock protein, when it's expressed on the surface, it signals the immune system, awaken it, and making it more available to identify these cancer cells. On the blood vessel level, the newly formed blood vessels of the tumor, they are not very well organized either. So when the heat is applied, these blood vessels constrict, they shrink, and by that reaction, the very blood vessel, it's damaged. It can be blocked by a microthrombosis, and that diminishes the perfusion or the deliverance of oxygen into the tumor. There is less blood supply provided to these cancer cells, so they're going to start dying by the direct effect of these metabolic changes, and there will be more acidosis produced. Some of these effects could be counterproductive, and this is basically why most of the studies and widely accepted use of hyperthermia is mostly in combination with chemotherapy or radiotherapy. That's the position that this therapy has in mainstream medicine at the moment. But it can not only be combined with these substances or treatments, but also with other natural substances, as we'll discuss further in this presentation. So whole body hyperthermia has different modalities. A subclinical hyperthermia is 35.7 Celsius, which is like a slight fever. Then mild hyperthermia, it's 38 Celsius, 100.4 Fahrenheit, a little bit more of a fever. And moderate hyperthermia, it's what is achieved by the device that we have, the whole body hyperthermia, and the local regional device as well. And the purpose is to increase the temperature, either of the tumor or of the whole body, to 39 or 40.5 Celsius, 102.2 or 104.9 Fahrenheit. This is applied for chronic disease, not only for cancer. It can also be useful for fibromyalgia or chronic fatigue syndrome. And when we use it with cancer on the moderate hyperthermia, it can be combined with chemotherapy or without chemotherapy. It be combined with other natural substances. Extreme hyperthermia is it's out there. We do not practice this kind here. It requires narcosis, which means applying medication sedate the patient because it's very hot and it has to withstand it for a long period of time, 6 to 8 hours. There is also the thermal spring therapy, which was used in Russia. And these, imagine that you have to spend 20 minutes in very, very hot water, 43 Celsius, it's like 110 Fahrenheit for 20 minutes. So these are the kinds of hyperthermia that are out there, different modalities, and what we use at Sanofi is the moderate. This is the whole body hyperthermia bed. It's the brand is Heckle HT3000, and it delivers the heat waves by an infrared radiation, which are the four beams that are placed on the chest and middle part of the body of the patient. The patient has to be closely monitored, all their vital signs, blood pressure, heart rate, and core temperature by placing a rectal thermometer. In this way, the patient is monitored by a nurse, trained nurse, and we make sure that everything's fine. At the very moment of the whole body hyperthermia, we can apply intravenous therapy. It could be low dose chemo. In this regard, I'm not gonna enter into detail because certain chemos work better if they are applied the day before. Anyway, we hydrate the patient at the same time. We can utilize at the very same moment intravenous curcumin, as we will see further, or also high dose vitamin C. But the person keeps hydrating with coconut water during the process, and it's comforted also by music. In this case, we also try to utilize and potentiate the effect of this therapy, which is rather strong on the psyche, and take advantage of the psychoimmune response, and by encouraging the patient to visualize healing imagery. It could be just visualizing cancer cells being destroyed, and all these tools that we also have provided by our psychology department that Jonas right here leads. Okay, the local regional hyperthermia, this heat can be delivered by microwave or radio wave. There are certain devices out there that utilize microwave, even though this is more difficult to regulate. It has a potential to have a side effect, and therefore we not really care about it. We have acquired a radio wave emitting machine. And we'll see a picture next in the next slide. There are some four, let's say, put it this way, there at this point that have four machines that have been developed in different countries with different megahertz, the power that it's delivered, and the consumption of watts, the energy that also requires the device to deliver this energy into the tumor cell. We have the Japanese, the Italian, the Germany one, and the Hungarian. The Hungarian only has one active electrode, while the Germany device, which is the Celsius 42, has two active electrodes, and we can control the penetration of the waves in a better fashion. Let's see. Okay, to have a better understanding of what these waves are, I just put this slide, which is the electromagnetic spectrum. And you can see on the far right the radio waves, that's the spectrum of the light and the electromagnetic, well, the emissions that come from the sun. So we see the radio waves are the less energy that they deliver. It's a longer wave. Then we have the microwave, and then we get into the infrared, which is our whole body hyperthermia. If you can see on the right side after the visible light, which is the light that we see from the sun, we have the ultraviolet rays, then the X-rays that are used for medical purposes, as we are all familiar, and we are also aware of their cumulative side effects. And then the gamma rays, the rays that are utilized in radiotherapy. So we are utilizing waves on the right side, which is more benign. The body can take care of it, and they do not affect healthy cells, which is a very important feature. So one of the, as I mentioned before, purposes of utilizing hyperthermia is to, in combination with chemotherapy, and as I mentioned, this is why it's acknowledged in mainstream medicine, because hyperthermia can increase the toxicity of chemotherapy, as I want to clearly state that we rarely utilize full dose chemotherapy, only in very selected cases. But with these, because of these abilities that it has to increase the toxicity, we feel confident to utilize lower doses, a 30% of the total dose, in combination with what is called the IPT. And these are the different drugs out there. That some of them are the increase of toxicity is linear, which is not a lot, but we have to be very careful with the exponential ones, cisplatin, carboplatin, mitomycin, mitoxantron. So we take this into account when we decide which dose we can utilize, and still the fine point or the art of combining these two therapies is basically in achieving effectivity and avoiding the toxicity. This is a chart in which it's a study that was run by another clinic in which mainstream hospital was able to put together the data accumulated through the years. And I want to mention that this is a growing field as well. There are many other studies being run at this moment, and it clearly has been seen how combining, in this case, the standard radiotherapy or chemotherapy alone, when it's combined with hyperthermia, there have been better responses in general, less toxicity, and better cancer control. A newer drug or substance that is taking a lot of attention now due to its it has been very well researched, and the ability that it has to decrease inflammation and take tumoral effectivity. It's curcumin, and curcumin also increases the heat response. The body can heat up faster when curcumin is being administered intravenously. Just an example, just if you want to look for more research, the internet is full of it, but they have been driving different experiment models in which they have these cancer cell lines, and they expose them to this the curcumin, and also increase the temperature, and they have seen these effects, inhibited cell proliferation, the speed on which cancer cells duplicate slows down, the tumor growth also it's inhibited, and it cannot produce new blood vessels, and the cancer cells that or that have lost their ability to die, they recover that program, and they just die. So this is a promising combination we also put together here. We utilized always selecting the treatments based on the patient status and also using other laboratory tools. Some of the side effects of the local hyperthermia, well, they're very rare because modern technology takes care of these parameters of safetiness, and especially the Germans are very, very meticulous about this. And of course, the first thing is not to do harm. However, there could be some hot spots in the subcutaneous fatty tissue in certain patients, certain areas of the body, mostly within the abdominal area. We have to be very cautious. In this case, when there's a pacemaker and we have to treat some nodules in the lung, we prefer to utilize the whole body hyperthermia because we don't want to just ruin the pacemaker and give another problem to our patient. Um, on sensitive or hypersensitive skin patients or patients that which skin has been previously irradiated, there could happen some first degree skin burns that can be addressed with aloe vera gel, not much of a problem. So, besides the or due to the effects that described in the previous slide of the heat on the tumor cells, the upregulation of the immune response. This is something very, very promising. This is one of the best things that we get out of the whole body hyperthermia. And we combine it with the regional hyperthermia as well, once a week, basically to get this response. The whole body hyperthermia and the effect on the tumor cell and the heat shock proteins that I mentioned before that are responsible to make the cancer cells more recognizable for the immune system. Once this is going on, the immune system, well, the T helper cells are increase their activity, which are the ones that go and tell the natural killer cells what they have to go and kill, and then even the natural killer cells become more aggressive, more effective, and the macrophages are the ones that are going to get there and clean the mess and digest the dead cancer cells. On the other side, the cytokines are the mediators. These are inflammatory mediators that also drive the body into this state of actively surveil the system and identify the cancer cells. So this immune effect of the whole body hyperthermia is one of the reasons why we decided to bring this device, and we have been using it in combination with the rest of the therapies we do here. Some of the side effects that have been seen with the whole body hyperthermia, and these I want to emphasize, this is based on the selection of the patients that we decide to put in that treatment. Sometimes their cases are so advanced that the proteins in their blood are not enough to hold the water inside the bloodstream or the blood vessels, so they can get swollen. General edema is just like water outside of the blood vessels. They can get swollen in the legs or sometimes the arms. Most of the time, the few times we've seen that is in the legs. Some of them can have these herpes or cold sores breakout. Skin burns are rare, but as I mentioned, certain sensitive skins have come up with some first degree skin burns, basically on the chest area where the light beams are placed. And as several other more difficult or severe complications or problems rarely happen, and this has only happened with very debilitated patients. So, in summary, the purpose of utilizing heat therapy or hyperthermia in cancer is to increase the efficacy of the chemotherapy agents if we have decided that's the best way to go and agreed to utilize a low dose chemotherapy. Radiation, we rarely see it, but in general, this is one of the reasons why it is used in mainstream medicine. Or other natural substances, as I mentioned, curcumin, or other also high dose vitamin C. Even though there are not many trials, there are some case reports only, but there are no clinical trials utilizing only natural substances with hyperthermia. It enables the use of a lower therapeutic dose of chemotherapy due to the exponential or linear increase of toxicity of these substances. It reduces the possibility of developing resistance against chemotherapy, which makes everything round up and more effective. And it is also an alternative to heavily treated patients that we mostly get patients on stage 3, 4 that have tried different other treatments, and still this is another chance to battle and to treat them, and it can increase the lifespan and improve the quality of life. There are very few side effects, like skin burns, nothing that cannot be treated. And also, well, as I mentioned, further studies are in progress.